Welcome back. If you're looking for help for an aged loved one who wants to stay at home, today a great home health care service that offers a lot of assistance.
A lot of great assistance. They include things like personal care, such as bathing and dressing, preparing nutritious meals, and helping with light household chores. Renee Mueller is the Director of Nursing for Med Group Home Health Care. Great to see you, Renee.
Morning.
Thanks for being here.
Thank you.
What a wonderful variety of services that you provide, because there are so many people aging today. We think about our baby boomer generation who want to stay at home and the comfort of home, the familiarity of home.
Yeah, it's really nice to be able to offer that to our seniors, of course, with the aging population that we have. And it gives them a different choice. And if they want to stay in their home, then they can. And a lot of people find that it's easier for them and they want to stay in their homes.
Yeah.
Don't you think that sometimes too, it's like they don't realize the services that are out there? I was just telling you, I have a 91-year-old grandmother who's like, I did 3 loads of laundry today. I'm like, you know, there's somebody to do that. Why do you think, like, how do you get somebody to go, hey, this is what we do? How do you inform people about helping them have a better lifestyle?
Yeah, I mean, there's a lot of education that needs to go into it, researching what you need at home. And sometimes they don't need all the services, they just need certain services. You know, we offer bathing and dressing and grooming. We have people that can make nutritious meals or light household chores. And then we also have, if you come home from the hospital or nursing home and you need like physical therapy and occupational therapy, or if they have a wound. So we have a variety of services to help those individuals. So it's just becoming educated on what they need and then coordinating that with their family and their doctors. And
yeah, I was reading about the skilled services that you provide, including what you said, which is chronic disease management, help with that, physical therapy, occupational therapy, you said, wound care, infusion therapy, new diabetic teaching. A lot of people aging, a lot of us actually have our concerns with diabetes. And I would think a lot of the initiation comes from loved ones, from adult children who say, hey, I think maybe you could use a little help around the house or a little help getting ready in the
Having
morning.
that talk is hard.
yeah, we're in this generation where we're in the middle-aged generation where we're caring for middle kids and we're caring for aging parents, and there's that struggle there. And we just offer the choices to be able to have peace of mind that your loved one is taken care of. So.
Right. How are you involved in the community? Because I got to imagine you have your finger on the pulse of a little bit of everything.
Yeah, I mean, we love being involved in our community. This year we were able to give away 300 turkeys along with some free flu shots and cupcakes to those that are in need in our community, and we loved that we were able to give back. And we had a couple people call us and say, thanks for making our Thanksgiving, because we were able to have a turkey dinner with our families. So that meant a lot to us. And then I have the opportunity to speak at healthcare facilities in the area and talk about educational topics, how to stay safe in your own home, and especially during cold and flu season, how to prevent some falls and other things like that. So
I think that's really nice. Who pays for your services, or how do people pay for the services that you offer?
well, most insurance companies, and we accept all insurance companies, will pay for it, or there is the option to pay privately if that's not covered by your insurance carrier.
So people just would need to check. Does Medicare sometimes cover the cost?
Yeah, home care is the Medicare benefits for skilled care. So if you need care coming home from a hospital or a nursing home, like I said, those things would be covered by your Medicare. And then for personal care, other insurance companies do offer that as well.
Okay.
For families out there that are listening right now that are going, okay, what's the process? I have this talk with my loved one. Now how do I get started?
Well, they can always give us a call, and if they're in need of personal care, we'll just have a nurse come out so we can develop a plan with them. What do you need? What are the services that need to keep you safe in your own home?
Right, looking around.
Right, and so then that nurse will come back, develop the plan, get the physician and family involved, and make sure that all that your loved one's needs are met. If you have skilled care, oftentimes that's arranged before you come home from a nursing home or a hospital, because your physician knows that you're going to need that. But we get into the home within 24 to 48 hours after you get home from the hospital, because that's really critical to make sure that you have services in place once you get home from the hospital and that you're safe.
I would think a lot of people watching today are going to say, is this a service where you can come to my home or my mom or dad or grandmother or grandfather's home? What areas do you service?
Yeah, good question.
Yeah, we service Milwaukee, Ozaukee, Washington, Kenosha, Racine.
Okay, so all those areas.
All the metro, yes, all the surrounding counties.
And how long have you been in business? Do you feel like you're being interviewed by us? Like we're a family? How long have you been in business?
We've been in business for over 7 years. Yep.
Yeah, that's
Yeah.
wonderful.
Yeah.
And I would think the cost depends on how many of the services you need or want provided for you.
Yeah, and that's something we could discuss with the family based on if it's more consistent or if it's just a one-time thing, and if they have 1 hour versus 3 hours. So there's lots of options that we can offer our families.
And you do a consultation then if people call you or email you, you can come out, visit
Yeah.
the home and do a consultation and estimate some of those
Yeah.
costs?
Yes, obviously they can call us at any time and we'll be out there within 1 to 2 days, and because sometimes the need is pretty emergent and we need to get in there. So we do our best to get in there right away, and the nurse can have that conversation with them and talk about what fits best with
That's
them.
awesome.
I gotta imagine you love your job.
Yeah, I do.
That's wonderful. Great to see you today. We're going to
Yeah.
share information so people can get in touch with you. It's great that you visit people so quickly once they make contact. You can call 414-755-2009, or they can be reached by email at info@medgrouphh.com. You can also stop at one of their 2 locations on Martin Luther King Drive in Milwaukee, also in Mequon on Town Square Road. Excuse me. And there again is the phone number and the email that we shared. Great to meet you.
Yeah, thank